Okay, so as we all know, Thanksgiving is coming up in a few days, and that means sweets. How many of you get up during the night just to get a taste of that pecan pie or whatever your favorite dessert is? I know I do. So here's the real question. How many of you actually get up to go brush your teeth after you eat that cake or pie? I bet 9 times out of 10 most of us don't. These poor dental practices could pose greater health problems in the future. Hi, my name is Alexandria Brennan, and today I'm going to be talking about oral health care in relation to Healthy People 2020. After doing some research, I have decided to talk about some key points that affect oral health care among people in America, especially those upon the poor community. By the end of my presentation, my audience will know some general information about oral health care, understand some obstacles that the poor community face in terms of seeking oral health care, and be more informed on some ways that Healthy People 2020 plans to intervene in order to improve oral health care in the U.S. as a whole. Before I get into the specifics, I want to give you some general information on oral health care. First, oral health care is essential to overall health. Oral health care practices influences a person's health in the future. This means that starting proper health care procedures early will help keep a person healthier much longer. This includes watching what you eat, going to the dentist, and brushing your teeth properly every day to avoid other oral health problems. Some of the more common consequences of poor oral health care include oral and facial pain, dental cavities, and periodontitis, also known as gum disease. These conditions could become worse, and over time, only cause greater issues in the future, such as the extraction of teeth, cleft palate, mouth sores, and taste disorders. Some of the more serious diseases are commonly associated with chronic health issues such as diabetes and HIV/AIDS. Although dental cavities are the most preventable oral health condition, dental cavities are the most prevalent chronic disease among children between the ages of 2 and 17 in the United States. In fact, the prevalence of dental cavities among children went up from 18.5% in 1994 to 23.7% in 2004. Poor oral health care can have an effect on everyday life, specifically with children. According to Dr. Mouradian and his research team, poor oral health care practices cause children to miss school and lose focus on education. It is estimated that about 52 million hours of school is missed annually across the United States due to dental issues. Periodontitis or gum disease is the most common dental disease among adults, most of which live below the poverty line. This disease is most often associated with smoking. Among these adults, gum disease is proven to be more prevalent among African American men with the history of smoking. These high number of casualties among the poor community is greatly due to a lack of resources and knowledge, which I will explain a little bit later. So now that you have some basic statistics on oral health in the United States, I will now focus on some of the key obstacles that the poor community face when seeking oral health care. There are several key issues that interdependently hinder people from gaining proper oral health care, including views of priority, certain perceptions and barriers they create, and limited accessibility to oral health care services. The first obstacle is priority. Essentially, survival comes first. Other things take precedence over dental care among the poor community, such as clothes, food, paying monthly bills, and transportation. Thus, dental health care is seen as a luxury. Because of this lineup of priorities, dental health care workers may pass judgment on the poor community. That leads to preconceptions about dental health care workers from the eyes of the poor, and this creates a gap that hinders people from seeking dental health care, and they in turn lose trust in the dental infrastructure as a whole. Along with these issues previously mentioned, it seems that accessibility is one of the biggest reasons why poor people do not seek dental health care. This lack of access includes a lack of insurance or insurance that does not include preventative services. Some poor people can't afford dental insurance at all. And if they do have insurance, it is oftentimes does not cover dental procedures, which requires patients to pay more money out of pocket or wait until they can go to an emergency room because of extensive pain. Locating dental offices that will accept insurance by the government, also known as Medicaid, also poses a problem. Many local dental offices do not accept Medicaid, and the ones that do require too much time and dependable transportation in order for poor people to get there, which they don't have. Another obstacle is having to wait for insurance coverage to activate. According to Shrimshaw and his research team, they gathered some information from participants, and studies show that some participants waited a range of 4 months to a year in order for insurance to activate, thus being stuck with the burden of pain and in a sensitive tooth. Another obstacle that the poor community face is paying dental services in full, and this is known as balance billing. Patients have to pay for the procedure ahead of time before the dentist will even see them, and then they will be reimbursed later on after the procedure is done. And this causes a big financial burden among the poor people. So now that I have identified some of the key obstacles in terms of receiving proper dental care, the question is, how do we fix these problems? My next few points will discuss some ways in which Healthy People 2020 plans to intercept these issues in order to improve oral health care in the United States overall. Healthy People is an initiative program that aims to identify major health priorities and work with other programs and organizations in order to improve health care as a whole in the United States. Things that are actually being done right now. Healthy People 2020 has claimed 2 leading preventative programs, including water fluoridation and school-based salient programs, and these are both proven to decrease the production of tooth decay, especially among children. Healthy People 2020 also has some plans for the future, and these include increasing the number of dental services within the local healthcare facilities to make it easier for poor people to access. They also want to provide more information or knowledge about oral health care and persuade people to make dental visits in order for early screenings for diagnosis of dental conditions and cancers. Healthy People 2020 are also planning to work with policymakers in order to expand insurance coverage and decrease costs of care. As I stated earlier, oral health care is vital to our overall health, and it is important for us as a community to put more attention on preventative care to avoid greater health issues in the future. By now, we should know some more general information about oral health care. We should have a better understanding of some obstacles that the poor people, that the poor community face in terms of oral health care. And we should have more knowledge about some ways that Healthy People 2020 plans to intervene to improve oral health care in the United States. So in conclusion, I would just like to challenge you to pay more attention to your own dental care. Make a dentist visit if possible, and brush your teeth in the morning and at night before you go to bed. Because after all, a healthier mouth makes a healthier you.